All right. Good morning, friends, Facebook friends, soon to be Facebook friends. This is Dr. James Dickey coming to you today from Olathe, Kansas, from my home office. Got some great information for you, some great value for you today about fat. So, pretty much everybody wants to be less fat and more lean, more muscular. Whether you're a man or woman, the more dense your bone mass is and the better muscularity you have, and the lower fat you have, the more healthy you're going to be. Now, I understand that some women are nervous about being too muscular, which is not going to happen unless you put extreme effort towards it. Um, don't worry about that. Women, you can train, you can weight train as much as you want. And as long as it's not your goal to look like a man, you will not. So please don't worry about that. But we all want to be less fat. So just a few short things here. I could go on this subject for hours, literally, and I'm going to try not to, just for the sake of brevity here. But if you're liking what you're hearing here, if you like what you're learning, let me know, and I'll expand on the subject in the coming days. But one of the factors I want to focus on today is that the more robust, the more healthy, the more bloated your fat cells are, in other words, the fatter you are, the more the enzyme aromatase tends to be active. Aromatase is an enzyme that converts testosterone to estrogen. Men and women both have testosterone. Um, and a healthy woman, for example, will have about 10 times as much testosterone as she will estrogen. So, just to dispel that myth that testosterone is a male hormone, it's true that men have much more testosterone than women do. About tenfold is a typical ratio. But it's also true that women have way more testosterone than they do estrogen, and it's a necessary hormone in both cases. And it's a hormone that almost nobody over age 30 has in the correct proportions, unless you're being very deliberate about diet and exercise and supplementation. So back to the point. How do we get the fat off? You need to decrease the fat for more reasons than one. You get the fat off, of course, by diet and exercise, right? So, but there's some things you can understand. If you understand why, then I think you'll understand how better, and you'll be more motivated to actually do it. So, let me make this fairly simple. uh, I want you to not think of fat as simply a cosmetic problem. Fat is not just something that you don't like the way it looks on your body. Fat affects you. So the fatter you are, the more risk you have for practically every disease. Certainly the metabolic syndrome, which is the beginning stages towards diabetes, is almost 100% caused by being too fat. Breast cancer, women, your risk for breast cancer is much higher if you are fat than if you are thin or lean. Same thing with colon cancer. We know that the more fat you are, the higher risk you are for colon cancer. Practically every disease state, whether you're talking about diabetes, stroke, heart disease, cancer, arthritis, even simple infections like a cold or a flu, all those things are going to be more common, all other things considered, other things considered equal, they'd be more common in someone who's fat than in someone who's lean and fit. So it's also interesting, the concept the rich get richer and the poor get poorer. The same thing with fat and skinny people, or not skinny, but fat people versus muscular fit people. Uh, when a fat person eats a meal and a muscular person eats the same exact meal, the body metabolizes it very differently in those different people. And that's largely related to hormonal effects that are affected by the metabolic effects that the fat tissue has. Fat increases inflammatory hormones, fat increases estrogen, fat tends to decrease your testosterone levels, and fat, like I said, promotes every disease. So let's get the fat off. And the more fat you get off, the easier it's going to get more fat off, and the easier it is to keep it off. And now I know you can debate that. I'd love for you to do so, and we'll talk about that at future posts. But here's the message today: carbohydrates, simple carbohydrates, simple sugars, or foods that quickly become high glycemic in your body, need to be consumed ideally just when you're exercising, right before, during, or after exercise. If you consume high glycemic index or high glycemic load meals anytime other than that, um, unless you are genetically gifted, your body's going to partition those calories into fat and not into glycogen stores and not into feeding muscles and other important things. So, what do? Number one, go ahead and enjoy your carbohydrates, but do it only within the first hour after a very aggressive workout or during the workout. Number two, Eat plenty of lean meats and healthy fats. And number 3, and probably most important, get moving. So I would love it if you'd all do 30 to 40 minutes of aggressive exercise every day, especially if that would be resistance training, weight training, or some other form of resistance. But whether or not you do that, additionally, do something to keep moving every hour. So get up and do 5 or 10 push-ups or sit-ups or pull-ups or jump a rope, on your lunch break. Go for a brisk walk or do 15 minutes of jump rope. But by getting active like this, you start retraining your body, not just for today, but for the long term, in how to start repartitioning calories and how to start using calories appropriately. So back to the simple conclusion. Fat is not just ugly. Fat is metabolically active. Fat increases your risk for cancer. Fat increases your risk for high blood pressure. Fat increases your risk for stroke and heart disease. Fat makes you tired. Fat decreases your sleep quality. Fat makes you less sexually proficient. It goes on and on. So what do we do? Save your high glycemic meals, which is sugary type stuff, sweet type stuff, for the first hour after an aggressive workout. Secondly, increase your consumption of healthy lean foods and healthy fats. And most importantly, get moving. Ideally 30 to 40 minutes of vigorous exercise every day. And if you can't do that, or even if you are doing that, get moving every hour. So make a goal for 10 times today to get up and do 5 push-ups, or to get up and go for a 5-minute walk. Maybe you're not a smoker, hopefully you're not. So, but when all the smokers go out today, well, you go out and run around the block one time. Take your shoes off, get moving. Some simple ideas. Be unstoppable. Send me messages. Give me questions. Love to interact with you. Be right back here tomorrow.